Welcome! I'm here again with Dr. Daniel Altschuler, and this time we're going to discuss more specifically the Chinese medical anatomy in relationship with the back and back pain and his experience in instructing it.
Thank you, John, and welcome to my house and have some tea. Thank you for inviting me back. It's wonderful to have you here in my backyard. So I think we talked before about some general ideas that could go wrong, or how to, look at some back issues. But it's very helpful to get a clear sense of what is the back, and so maybe we can talk about that a little bit today.
So Daniel, what is the back?
So the spine is really interesting. It's divided into maybe 4 segments, and from the neck into the head is 7 cervical vertebrae, and then from the 7th vertebrae, below the 7th vertebrae, the torso is made up of 12 thoracic vertebrae, and then that takes you down to the lowest rib. And then you have the lumbar back. Yeah. And so the ribs, pardon me if I'm tickling you there, comes up to, I think you have to turn around a little more actually. So the rib cage, the lowest part of the rib cage comes up, and that takes you to around the 12th rib. So not the 12th rib, the 12th thoracic spine. The cervical spine ends with the one spine that protrudes at the base of the neck. That's C7. And then there's the thoracic vertebrae. There's 12. And then from the thoracic vertebrae, you start with the lumbar 5 vertebrae. And then that takes you into the sacrum, which is 5 vertebrae that are mostly fused and ends in the tailbone. And so that's the structure. And I believe, I think this is true, that every mammal has those 7 vertebrae, from small animals up to the giraffe. I think they all have that 7 cervical vertebrae. It's kind of interesting.
That's neat.
So,
and cats have an extra thoracic vertebra?
I don't know.
I've heard that so that they can twist fully around as they fall.
Well, I know that the spacing that they have is much more vertebrae to vertebrae than humans do. So that also part of their, the rag doll approach, right? So if we all could have that kind of a back, we would save a lot of money.
That's right.
Going to the doctor. And each of those vertebral sections or segments has its own curve, so that it ends. You have the inner curve from the top of the neck going in to the C7, and then the thoracic part is relatively straight, right? And then the lumbar has another curve in it, and then pushing out to the tailbone, which creates the shape of the buttocks, right, and then down. So along with the pelvis, and so that's a natural kind of an S curve, and I guess ideally, from an anatomical point of view, that's all in it. All of those vertebrae are in their place, and not overly curved inwards or outwards or sideways, right? Then you have things like scoliosis or hyperkyphosis, and things like that, which some people just genetically suffer from, or maybe I shouldn't say suffer, but they genetically live with those types of changes in their spine. Yes, and so that's something that very common. Some degree of shift. Nobody has a perfect anything, right? So
We're all perfect.
We're all perfect inside, yes. Potentially Buddhas, I've been told.
That's right.
Yes. So it's important to know that anatomy, so that when you're moving, you're going in the natural curve of the back. And there's the TaiYang Classics is very interesting. It says the back should be like a bow. And that particular classic about Taiji trend is talking about how to release energy. And I've heard different teachers talking about it in very different ways. It's very interesting that you could take the same phrase and turn it around, right? But one teacher that I had talked about that meaning the string part of the bow, so that when it's pulled taut, then you can release it, and it's like the arrow coming.
Right.
But somebody else, also, equally high-level practitioner, Chinese practitioners, both of them, talked about that phrase, talking about the wood side of the bow, bow and arrow bow, right?
Right.
And so he said, like, you have to maintain that natural curve like a bow. And so I thought that was interesting.
A different trend or interpretation of it.
Totally different interpretation, two ends of the bow. But I think for our purposes, keeping that the wood side of the bow being, more, not exactly obviously, but that idea of having a natural curvature in the bow has a certain use. That makes the bow useful too, right? It's not just the string. You can't just tie string onto two ends of a stick. The reason why a bow has those curves is, centuries and millennia of experimentation on what's going to make the best, most flexible and most dynamic support for the string, I guess.
That's right.
Say.
Sure.
Anyway. Something interesting, maybe.
It is interesting.
So when we're doing exercise or we're doing Qigong or Taiji or anything, I think it's very important to be aware of the structure so that we're not insulting that structure.
Compromising.
Compromising it, and keeping the natural curvature, right? So. We're going to talk about the structure, not the problem, so we should probably not get too distracted.
Is there a certain perspective that you would like to share also about not just the structural anatomy of it, but also the traditional Chinese perspective on the spine?
Yeah, that's very important too, because it's very dynamic. It's not just a series of bones in a certain place. The Chinese model of the body, they work on flow and kind of like bus routes or train routes. So you have more of a pathways by which things are flowing, and that's always been very important in the Chinese model. So the back is basically three channels, three channels. We can say three channels. We include the side, right? And four if we take the Dai channel. So there's the spine itself, through which what's called the Du channel flows. The Du channel, often translated as the governor's vessel, governing vessel, not governor's vessel, governing vessel. So Du in Chinese has the idea of to govern or to manage something. So I think it's just translated as governing channel because of that. And that starts in the perineum, which is the space between the front and posterior orifices. So right in the middle. And then that comes up the tailbone. Sometimes people talk about going inside, like in the front of the tailbone, the front part of the body. So and up the inside of the spine or the front part of the spine. Other times I hear it talked about going through the spine, and of course I've heard people say it's on the outside. But I think I like to think of it as actually going up the middle of the spine, because that's where the marrow is, and the marrow flows. It has its own circulatory system of cerebral spinal fluid, plus nerve conduction and all of that. So the Du channel regardless of where exactly you put it, it's not, I think, super important. Again, these are important processes that we can understand the structure of the body, and clinically, it's we can use it this way very easily. So going up along the spine or through the spine, however you wish to see it, and then all the way up from the spine into along the skull to the top of the head, which is a very important point. In Chinese called Bai Hui, the meeting of 100 channels. So it's a focal point of all channels. Oh, we got a visitor here. Squirrels collecting their winter food. So the channel then goes up along the center of the back of the head, the occiput, and meets at the very top area, which is the center from the nose to the back, the center line, and then at the tip of the ears, the kind of the map coordinates where that all meets. And then each person's a little different. You have to look at a little bit of the soft spot. It's where the sections of the bone, the different bones, the sutures,
the cranial sutures.
Yeah, they kind of all meet there, and different people have different degrees of space there. So you can feel it. Sometimes it's a little off center, little front, little back. So and so that's a very important place to remember, just in terms of clinically, but also coordinates. So Bai Hui, and then coming further forwards, it comes down the middle, this third eye kind of place between the eyes, and down the tip of the nose, and then I just call Renjong. The center of the Renjong is, in Chinese, it's center of the person, or Shuizhong, and then inside the top lip, and then it kind of ends, right? And then you have another channel that comes up the front of the body, and then ends in the back of the mouth through the tongue, and then the tongue connects these two channels, and then you have kind of a full front and back circuit, right? So if you do Qigong, that's the circuit that is talk about the what is that? The small. How do they translate it in English? A small heaven channel, or
Xiao
Yu Zhou,
I think, or something.
Celestial
like
circuit, is it?
Yeah.
Anyway, it's a very important concept in the Qigong, where we have this continual connected pathway from the front channel and the back channel. So there you go. That's the Du channel, and then from the middle of the eye, the inside corner of the eyes, coming up the inside of the eyebrows, up the top of the head. There's a little bit of a jaunt outward, but generally speaking, up the top of the head, adjacent to the Du channel. This is the foot TaiYang channel, connected to the bladder channel, bladder organ. It comes up adjacent to the Du channel, and it actually goes into the head around that, at that Bai Hui, that top point, goes inside the skull and then crosses over. So the right side then switches to the left side switches to the right, and then continues to come down, and then emerges out from inside the skull at the back of the neck at the occiput, and then continues down the neck, and then kind of opens up into two channels on either side. So there's 4 channels running down the back, an inner channel and an outer channel, both coming down all the way down, and then into the tailbone, along the side of the tailbone, and then down the buttocks, and then down the back of the leg, following the hamstrings, down the back of the leg, right in the center, down the Achilles, and then out along the outside edge of the foot to the pinky toe. Yeah. So that's a really long channel, and it's got two separate channels. I'm not even talking about the inner stuff and all the connectors. This is just the basic outline, and it goes all the way down there. So you can easily see that in Chinese medicine, any back problem is going to affect or be helped by something connected with those two channels. 5 lines, right? The center line of the Du channel, and then on either side there's the 2 lines of the bladder channel. So 5 lines altogether, 5 channels altogether that go down. So that all of those are really important. And then there's 2 other channels we should talk about. Another channel is called the ShaoYang gallbladder channel, and that's also a super long channel. It starts on the outer edge of the face, of the side of the eyes, coming up. It goes several lines, 3 lines along the side of the head, down the neck along the side, and then around the axilla, the armpit, down, all across the ribs, and down the side of the butt. So sciatica is very commonly associated with this. And then down the leg, which is anatomically, or in a physical therapist's office, would be the IT band. And then down the middle of the leg, some people put the channel here, some people put it there. But anyway, down the side of the leg, and then out to the right there. Between, like, on the inside of the pinky toe, kind of between the 4th and 5th toes. And so that takes care of, or is affected by, or affects the entire side of the body. It's also a huge channel. And then the last channel is what's called the belt channel, the Dai Mai. And that wraps around the inguinal area, around the pelvis, and then to the spine. And so you have what's called a belt channel. So it's like where you wear your belt or a sash. And that channel connects all the front channels with the back channels. And that's actually a very interesting channel, because often when people have back pain, sometimes it's just something with the spine, but also it can be something with the abdominal muscles.
Right.
Too tight, or the psoas muscles and things like that. And those muscles can get tight and start to affect the back, and you don't even know it's coming from the front. So those channels, by thinking about those or considering those channels, sometimes you can get a lot of information that way.
Yeah, really important to recognize how things connect, not just left and right, even anatomically, like the corpus callosum inside the brain, but also front to back and diagonal through the body. And so these channels all have references so that we can understand how everything relates to everything else. Everything connects and impacts everything else in the body, which is why we need a kind of harmonious style of practice and treatment to integrate all of the different aspects of the body, since everything impacts everything else.
Very much so. And the directionality of these channels also becomes important too. There's a certain flow, just like any river system or canal has a certain flow that you have to be mindful of if you're piloting your boat down it. Because if things are moving in the proper flow, no log jams, right? Then everything just kind of moves along the way it should. But as soon as a tree falls, or the sandbar builds up after a storm or something like that, then you have these obstacles and pitfalls and dangers or whatever.
Right.
So, in the Du channel starts in the perineum and goes up the back. It has an upward flow down to here. The other 2 channels I mentioned, the bladder channel and the gallbladder channel, they start at the top of the head and come down. So we have the central upward flow, and then the 2 that are flowing down. And the implication of their flow can be sometimes maybe more important for internal medicine, right? Knowing, like, for example, the gallbladder has bile and it goes down, right? If it goes up, it's no good, right? That's kind of like gastric acid, acid reflux. You're tasting bitter taste. That's a backward flow of the gallbladder system. But generally speaking, when they're flowing in the correct direction, then everything's at ease and working correctly.
Right. I also like to think of it as structurally during standing posture, which is something we work on quite a lot, is that when you're standing correctly, there's this sense of internally, just like that dew channel through the spine, and that the deeper structures, they hold you up, and there's this sense of rising and levity in the body. And the more external channels, the soft tissue in the body kind of drapes and fills downward. And so there's this sense also just structurally as we practice, that same kind of rising and sinking at the same time. And they're appropriately balanced to each other. And so there's that quality as well, even in our practice.
Yes. So 12 channels, all of them have 6 upward, 6 down, right? And this is not maybe the appropriate time to talk about all those channels, right? But I actually have those videos if people are interested on each channel. But they have there's an up and a down equally balanced. And this is also a bit interesting, but the channels that are these back channels are yang, which generally speaking yang rises, but the yang channels actually descend. And the channels that go up are the yin channels, the ones that are on the inner side of the medial side of the legs, they go up. And so, there's always an interesting question of how come the yin is going up and the yang is going down, because yang goes up by nature, yin sinks and is heavier by nature. And if the yin were to go down as its nature is, and the yang goes up as its nature is, then there'll be a complete separation of yin and yang, and no circulation, and which is clinical death in Chinese medicine. So we don't really want that.
Yeah.
We want the yang to be brought down, and we want the yin to be pulled up. And so there's this really beautiful cycle, natural cycle that happens. And to augment that, or if it doesn't happen, then you have some stagnation or some disruption. It could be from an injury. It could be from, I don't know, emotional distress, Could be from all kinds of stuff. And then you're going to have some sort of discomfort, pain or distension or difficulty walking, for example, so and so if we have our natural healthy flow, and then what the Chinese did so beautifully was create these Qigong systems to enhance and make sure we maintain that flow, repair our old bad habits that have, what I do all the time is sit on the couch and read, in weird postures. My kids do that, and for studying, reading, and so whatever we're doing, right? And creating some sort of major or minor disruptions in that flow. So it's amazing how they've created all these systems.
I think so too. Yeah, and I feel really fortunate to have access to this depth of wisdom. People that have been human for a long time, and we've all developed the same problems over and over again. And the people say, well, what do we do about that? And we get better at figuring out ways to prevent it, to augment the healthy aspect of our nature, and to hopefully share it with their families so that we prevent a lot of this unfortunate, unnecessary pain and suffering.
It's, I think people do yoga for similar reasons, the idea of stretching to stretch out the knots and kinks, Qigong is distinct and different from yoga. Each of these systems have their own unique specialties, and so Qigong. Maybe you can explain what the Qigong does for these channels. This particular Qigong is specialized in the back, isn't it?
It is, yeah. Its emphasis is around opening the spine and expressing the channels appropriately that relate to the back, the ones that he's describing. And it is emphasizing this capacity of removing obstruction, of getting out of the way, of becoming soft, of increasing flow. A lot of the yogic principles perhaps are, of course, depending upon the teacher and the system, are designed more around using force against force. Perhaps I brace myself against the floor or against the wall or another part of my body, and I apply pressure and force something to move in a way that it wouldn't on its own. Or perhaps I lock one aspect of a joint with the idea that it will increase circulation elsewhere in the body. And preserving more of this traditional Chinese medical principle of increasing flow, of increasing harmony, of, thank you very much, of offering and sharing within the system so that the internal organs are nourished rather than stressed, is that the body overall becomes softer and more comfortable rather than pressing it into a situation. That tends to be something that doesn't exacerbate old spinal pain. If somebody has an arthritic condition or an inflammation condition, they should be practicing in such a way that the body doesn't feel stressed and isn't reacting to that discomfort. Whereas if they're doing something that's a little bit more stressing upon the system, which might be appropriate for certain people, the people who are more delicate, the way that I grew up and have spent most of my life, all of their aches and pains get exacerbated, and their system never has the chance to heal because it's always dealing with this old injury that they never quite recover from. And so ideally within this system, everything is gently nourished without ever feeling harassed.
It reminds me of somebody I saw just yesterday. He has a recent injury, and it was to his calf muscle. And the way he was dealing with it was to kind of push through it. Mm-hmm. So he was stretching it out, and doing all the activities he did that caused it in the first place to try to get back to right where he was, right? And so I the first thing I said was, don't do that. To start in a more gentle way. Yeah. It's really hard to stretch things out, it's stretching in general is great, but when you have an injury to a muscle system, or especially also to the bones or the spine, right? Stretching is forcing, mm-hmm. And or most stretching
the way most people do it.
But even if you're like an old hand at yoga, like doing that stretching is not always the best thing to stretch out the muscle that is at fault, right? So doing a much more gentle approach to allowing things to settle back in place, not immobilizing either. We don't want to just immobilize things because then things get stiff, but keeping a gentle motion and allowing it to settle back in place, always ideal.
So one of the things that has been mentioned often with some of the teachers that we work with, and many of the traditional instructions, is they talk about the nature of the function or the flow and the movement has a really strong impact upon the form, the actual physical substance of the body. Have you seen that much in your clinic?
I'm not sure about clinic actually, but it's something I talk to patients about. I see quite a few patients who have, of course, spinal pain, lumbar back pain is so common, but people who have things like scoliosis or things like scoliosis, where it could be from a car accident, all kinds of thrown from a horse,
right,
where things get shifted, right? So aside from what you can get help with, like from professionals like massage and acupuncture and TaiYang, things like that, what you can do for yourself is, regardless of whether it's an inborn twist of the spine or through an injury, whether it's painful or not painful, if you create your own internal structure and it's like almost an imaginary visual thing, using your mind to kind of connect the lower part of the spine up to the top of the head, for example, even any section of that, or even better, the whole section, that actually is a really important way that you can start to heal yourself. And by not just creating a flow, that's something else. I mean, that's awesome if that happens, but just creating the stability through lining up the 2 points
Right.
of the torso, and it's actually quite amazing. You know, I've known very amazing high level martial artists who have all kinds of injuries and all kinds of, you know, disabilities and challenges, and you would never want to meet them on the wrong side of an alley. You know, they're incredible, and they've created the structure and the flexibility just by overcoming these challenges through knowing the channel system, especially the central one. That's kind of the most straightforward, literally, and in most accessible, and creating that through their meditations or visualizations before they go to sleep or when they're walking, you know, and that aligns up. Once the things are lined up, even just energetically, so to speak, that can be a loaded term, right? But just energetically, then actually certain healing happens and certain pain can go away or be lessened. It's quite amazing. So
That's really useful. Very helpful tip for practitioners.
it doesn't happen overnight, though. It's something that you cultivate little by little by little. So, and doing external or internal Qigong, that basically it's just another type of Qigong. Just creating through the mind or through the body, reestablishing those structures.
That's wonderful.
Yeah.
Do you have any favorite literature or resources for people who might be wanting to learn more about the channels or the points, the logic of traditional Chinese medicine?
Wow, there's so many books out there. It's like which one not to read. It's kind of maybe I think if you're exploring this, obviously this Qigong channel is amazing. There's you know, please explore all these videos
in order.
Yes, in order. I was just talking to John about not knowing where to start, and start in order. You know, learn how to relax the body, learn how to start moving in the correct way, because we have these habits that are not correct. We all do, even, you know, unless you're a toddler. You know, I think I don't know. I wonder when we start to go off.
Yeah, go astray.
Is it 1 year old? Is it 2 years old? 3 years old? You know, as the spine goes, and then, you know, every who knows? Like, you know, every time I get knocked off the jungle gyms, who knows, right? Who knows? No use speculating about the past, about my past anyway. But yeah, and there's so many books out there, and I don't really read them all, but the basic information should be clear and simple and straightforward.
Great.
You know.
Okay. I'll post some links down below, and as well, of course, more information about Dr. Daniel. And if there are any questions, of course, please do share in the comment section. And I can't promise that he'll answer them all if you have questions for him, but I can certainly get him to try.
Your questions will spur another conversation.
That's right. I hope so. Thank you so much.
It's been wonderful.
It's so fun. And thank you all for joining us. Please do continue to practice.
Keep your spines curvedly straight.
Brilliant. That's great.
All right.
Hooray! It worked.